morning, you all. We are October 9th at 9:30 in the morning, Boonville, Missouri. I thought I would give you a different background. You've been watching the same background for a while. So this is a different version or background from my dining room table where I do all these. Okay, so there's been some information update on COVID-19 as far as protection as well as treatment. And I have a personal reason for doing this one. My uncle, Elmer Halley, is in the VA hospital in Columbia, Missouri. He's in his 90s. He is in the ICU. He's on a BiPAP machine, and he's got a nasogastric tube in to feed him. And I sent some information to his daughter yesterday about high dose vitamin C intravenous therapy, which has been shown to be helpful with COVID-19. So my uncle's in his 90s. We'll see what they do with that information. I just told her ask his doctors whether or not that's worth trying. So I read a report yesterday from a physician who remains unnamed on purpose, who has been using high dose intravenous vitamin C therapy for treatment of COVID-19 patients and seeing fairly remarkable results, usually within 3 days. So we're going to go back and talk about some of the things that I've previously talked about on how to protect yourself. And this is information that goes way back to January of 2020. So if we would have done all this, I mean, we've got 7 million cases in the United States and 210,000 plus deaths. China is reporting way less deaths and cases. Maybe they're not telling the truth. It's hard to say. South Korea seems to have figured out how to avoid this. And I read an article from a physician in the Philippines, which has been on the Philippines has been on lockdown for about 6 months, with no real change in COVID cases, except maybe the last 3 or 4 weeks. So, if you go back to January and June, we talked about some things that you can do to protect yourself. This is more basically on maybe what to do. Well, I'm not going to say that. Maybe what to do if you actually have symptoms from COVID-19 and you have a positive test. So basically, we've talked about zinc and quercetin. We've talked about black cumin oil. We've talked about fish oil to get the oils, or to get zinc into your cell as an antiviral. So there's been a lot of information talked about how to prevent infection by the SARS-CoV-2 virus, COVID-19. So washing hands, using sanitizers, keeping physical distance, wearing a mask. I've done all that. I teach face to face at State Fair Community College. So there's hand sanitizer. You have to wear a mask when you're on campus, when you're in the building. So the coronavirus, which produces COVID-19, seems to have some highly infectious. It seems to be highly infectious. So it survives for long periods on surfaces. So my students, they have tests next week. I told them I'm going to email them the test at the start of class rather than print that, so we can avoid potential COVID-19 on papers. We sanitize desks before and after class, etc. And COVID-19 seems to be transmitted from infected people to others via respiratory fluid, so that's the reason for the mask. So what do we do? There are comorbidities that seem to increase your risk of death or significant infection. So my uncle is in his 90s. He's healthy, but he is in his 90s. And so the comorbidities that are associated with COVID-19 are obesity and diabetes, cancer, heart disease, age greater than 65, and then of course nutrient insufficiencies or deficiencies. Okay, so the immune system is how you protect yourself. It's a complex system. It requires multiple steps to have proper functioning, and there are a lot of enzymes and cofactors, vitamins and minerals that are needed for your immune system to function optimally. Okay, so the COVID-19 virus, it's an RNA virus. It has spikes on its protein coat, and it utilizes the ACE2 um, receptor to get into cells. So angiotensin converting enzyme 2. So I put up on Body Solution Systems website yesterday a homemade elderberry juice, and elderberry blocks the ACE2 receptor. So you can use elderberry jelly, you can use elderberry juice, you can use elderberry gummies, or anything elderberry to help block that receptor on cells. The most common symptom presentation for COVID-19 is fever, cough, and dyspnea. So my uncle has significant fatigue and cough. He did have a fever that's under control. There's also sore throat, myalgia, which is muscle pain, fatigue, headache, and diarrhea, and then loss of smell and taste. I've heard from several people that I personally know that lost their sense of smell and taste. They weren't significantly sick, and it took several months for that to come back. We talked about cytokine storms from the immune system. There's clotting involved, so people that are in there have a higher risk for blood clots, such as men that are overweight or women on birth control pills or hormone replacement therapy should consider a small dose baby aspirin, 81 milligrams a day. Okay, so the prevention protocol from orthomolecular medicine, which was started by Linus Pauling, we talked about him before, he was the vitamin C guy, is the following. So as far as food, you want to eat a diet rich in whole foods with high antioxidants. So citrus fruits, yogurt, almonds, spinach, garlic, onions, ginger, broccoli, red bell peppers. You want to avoid sugar. You want to avoid simple carbohydrates. You want to avoid refined carbohydrates. Avoid processed meals, which means things that have been altered, put in a box, etc. Eat your fruits, eat your vegetables, eat nuts, hydrate with water. So a typical water requirement is to take your weight in pounds, divide it by 16. That gives you the number of 8-ounce servings of water you need a day to stay well hydrated. Okay? Make sure you sleep 8 hours, 7.5 is ideal. Exercise 3 times a week. It doesn't mean huge exercise, just take a walk, 20-30 minute walk 3 times a week. Relax, meditate, listen to some music, read a book, do whatever uh, take take that 15-20 minutes for yourself per day. The supplementation, I have this on Fullscript on my dispensary. I'll add to it because it keeps changing a little bit. So take a multivitamin once a day, vitamin C 3,000 milligrams a day. The treatment that I read this paper, 22 cases giving people with COVID-19 that are symptomatic in the hospital 25 grams of intravenous vitamin C daily. Okay, so most people take 500 milligrams. There's been some reports about people on 200 milligrams. It doesn't seem to do anything. I don't, Linus Pauling talked about 500 milligrams a day to avoid colds. That was found not to be true. It was found to be true in certain instances. Certain people had the right makeup, but it's fairly true that vitamin C is antiviral. And when you get infected and you have a viral storm, like what's happening with COVID-19, your vitamin C is depleted significantly, so you have to catch up. If you don't catch up your vitamin C, you basically wind up with a viral induced scurvy. Okay, and so part of this viral infection has to do with blood and blood clots and damage to organs. So it appears to be that significant high dose vitamin C um, is helpful in fighting off this infection once it's set in. Vitamin D keeps getting different recommendations. So I've seen 2,000 international units a day. 5,000 seems to be the most recommended. I've seen 10,000 international units a day. And there's one physician, functional medicine physician in Texas, that's recommending 10,000 international units a day all the time. So toxicity of vitamin D can happen, but you have to take huge amounts of vitamin D to get toxicity. And one of the reports I read yesterday was giving people with COVID-19, symptomatic COVID-19 infection, 18,000 international units daily. So we're talking about 180,000 units a week. So 10,000 units a week is 70,000 international units a week. That's well tolerated. You don't see toxic symptoms until your vitamin D reaches about 400. The upper limits of normal is 100. It's an easy blood test to get. Most people are vitamin D deficient, and vitamin D protects you and it boosts your immunity significantly. So there's more and more research about vitamin D all the time. So vitamin D seems to be a big deal. 5,000 units at minimum. 10,000 international units is probably better. Zinc, 30 milligrams a day. I've seen 20, I've seen 50. 50 is easy to obtain, assuming there's not a shortage, but 30 milligrams seems to be reasonable. Magnesium in the maleate or citrate or chloride form that you can mix in water, 500 milligrams a day. Selenium, 200 micrograms daily. Probiotics, greater than 30 billion per day. Quercetin, 500 milligrams a day. We've talked about that one. And N-acetylcysteine, that's probably worth a class on its own, 500 milligrams daily. And then melatonin is 1 to 5 milligrams a day. I've seen 5, I've seen 10. If you're having trouble sleeping, it's 20. Okay, so let's talk about vitamin C as an antiviral. There are 11 antiviral mechanisms for vitamin C. Should be the first line of defense. There is a quote, let me see if I can find it. Let's see, I gotta find it. Okay, this is from a chest physician, so a pulmonologist. This is a quote: "Some physicians would stand by and see their patients die rather than use ascorbic acid, vitamin C. Vitamin C should be given to the patient while doctors ponder the diagnosis." So that's how important vitamin C is in fighting viruses. So vitamin C is worked against every single virus, including influenza, pneumonia, and even polio. Okay, so COVID-19 is a serious contagion, and contagion is basically dependent on the susceptibility of the host. Okay, so fairly well established that even low vitamin C levels increase susceptibility to viral infection. So you can measure your vitamin C level if you want. So 200 milligrams of vitamin C a day resulted in an 80% decrease in deaths among severely ill and hospitalized respiratory disease patients. Okay, so the thinking is a coronavirus pandemic, which we're in the middle of, can be stopped with immediate widespread use of high doses of vitamin C. Okay, vitamin C taken orally, if you're not sick, can cause diarrhea and bowel symptoms. If you are sick, you don't get the bowel symptoms because you're sick and your vitamin C is depleted. If you get an IV, you don't have to worry about bowel symptoms. Okay, so vitamin C seems to be there's a plethora of evidence showing that vitamin C is helping in this viral contagious pandemic, especially if you're sick. So I've given that information to my uncle's daughter, so my cousin. We'll see what happens. This guy's, he's mid-90s, and so if his doctors say something, well, it's going to be That's a huge amount of vitamin C and blah blah blah. I don't know what kind of medical treatment he's getting other than BiPAP and um, I think 1,900 calories of food by a nasogastric tube. But if it was me, and I'm 60, if I'm in the hospital and I have COVID-19, I'm going to ask them to give me intravenous vitamin C. I don't take as much vitamin C as I've recommended. It's 3,000 milligrams a day. I have the chewy ones, and I forget to take them because it's not in my routine. But I do take my all the other things that we talked about. I take pretty routinely. I'm taking zinc. I take black cumin oil. I take fish oil. I take garlic. Um, I take a senescent thing to prevent age-related cell breakdown. So there's things that are out there. There's things out there that you're not being told. I don't know why. I don't get it. Who knows? I had a video blocked by or taken down by YouTube for talking about that horrifying antibiotic um, that's used for malaria. So I'm not even going to say it. It'll tag it. But that antibiotic isn't the point. The antibiotic is to get zinc into your cells. I've said this before. So zinc in the cells. Elderberry juice, gummies, syrup, jelly, whatever you want to block that ACE2 receptor seems to help. Mulberry, I've got a product on sale in St. Louis that has elderberry, mulberry, and beets in it. It also has zinc and vitamin D and 1,000 milligrams of vitamin C per dose that you take as a capsule. So even that's not enough vitamin C, right? According to that. Wendy, Linda, Corey, how are you all doing? I was looking at a different screen, so I didn't see you all on here. So the thing is, we've had no leadership really from the CDC, the FDA, the U.S. government, et cetera, as to what to do. What do we do for treatment? We don't, all they do is argue about what's the best treatment. Well, orthomolecular medicine, which has now been around since 1968, is basically treating yourself with vitamins and minerals and over-the-counter supplements, etc., that can avoid having to be pharmaceutically induced things. Okay, so who wants to be in the ICU? I mean, this my uncle. He's a strong guy. I told my cousin. I said if coronavirus has probably met its match by meeting my uncle, because this guy was he was there at the surrender of the Japanese on the USS Missouri. He was supposed to go to Hawaii for a 75th anniversary for that. They canceled the trip over this COVID thing. He winds up getting COVID. He's in the hospital. Um, we'll see what happens. If his doctors give him vitamin C IV, they probably won't. Um, but that, you know, that seems to be a reasonable approach. I mean, what's going to happen if you give a guy vitamin C who's in his 90s? If they're worried about hurting him, he's 90 something, he's in his mid 90s, and he has COVID. So at this point, if I'm him or if I'm me and I'm in the hospital, you just pull out all the stops. You're not going to wait for randomized placebo controlled studies. We're not going to have a vaccine. Dr. Fauci said we won't have a vaccine until late summer 2021. So where's the leadership from the government, the CDC, the FDA? Where's the leadership? What do we do? What do outpatient physicians do when somebody comes in or calls? You're not supposed to come in if you have COVID. If you call your doctor and say I have COVID-19, what do I do? And they shrug their shoulders because they have no recommendations from the leaders, right? So for some reason, all this information about what we're talking about today has been blocked, hidden, taken down. It's false. It's that. It's this. But what do you got that's true? Put that out there. It's not there. So that's my little class, 20 minutes for today. I've shut up about COVID-19 for a while, but there's more and more evidence. Vitamin D, vitamin C, all the supplements we're talking about. So vitamin D, 10,000, probably better than 5,000, but at least 5,000 international units. And take 3 grams of vitamin C. Okay. Um, we will reconvene on Monday. I won't talk about coronavirus. Maybe we'll see. We'll see what develops over the weekend. And you all have a great day. It's a great fall day. It's going to be 85. It's that summer part of October here. And I'll talk to you Monday. Have a great weekend, and I'll see you Monday. Bye.